Welcome and thank you for being here once again. End of the year, and as you turn on television, we're seeing a lot about Medicare and the possibility of changes in Medicare. Matt Ladich is our guest from Senior Care Plus on our program today. Matt, nice to have you here.
Thank you again for having us.
What is the big deal with the end of the year and changeover in Medicare? Now, I've had Medicare for many, many years, and I'm very happy, I think, with the plan that I have. And why the end of the year? Are there automatic changes that come up, or people can make changes at the end of the year?
Yeah, every year Medicare has had what's called an annual election period where individuals can switch or change or drop out of plans that they're on. The big thing that we're trying to get out into the public recently is the Healthcare Reform Act had some changes on the election dates, and it used to be November 15th through December 31st. And they've changed that and moved it up a month, October 15th through December 7th. So we're wanting to make sure that people are aware of those changes and that know that they can make those changes or options or enroll on different plans during that time period.
Is Senior Care Plus a supplemental to the regular government Medicare?
No, we're actually a little bit different. We're a Medicare Advantage plan, which used to be Medicare Plus Choice before Part D was introduced as part of the Medicare Modernization Act of 2003, enacted in 2006. When we became a Medicare Advantage plan, we're actually directly contracted with the federal government to administer the Medicare benefits that those beneficiaries receive in a local service area. So Senior Care Plus is actually contracted with the federal government to take over or essentially administer the Medicare benefits here in northern Nevada, in 6 counties in northern Nevada.
So even though you're a private organization, you are funded really by the federal government. So it's the same dollars that probably I am myself receiving just being involved with the federal government program, right?
Yep. Renown Health is not for profit. Hometown Health is not for profit. Senior Care Plus is not for profit, but we do receive funding from the federal government to reimburse us for the medical expenses of our Medicare beneficiaries.
Matt, give us a history of Medicare. Started roughly when? How many years ago?
Social Security Act back in the 1960s. From the Social Security Act, Medicare was created. That didn't involve Medicare Advantage or Medicare Plus Choice or private insurance companies that took care of individuals. It was essentially original Medicare, traditional fee-for-service. And then the Medicare Modernization Act of 2003 was probably the first large-scale healthcare reform act that supplemented the Social Security Act of 1965 that introduced Medicare Plus Choice, Medicare Advantage, where private insurance carriers would actually take care of individuals rather than the federal government. And then also Part D, the big Part D change in 2006 that came 3 years later, was a part of that.
What does Part D mean, and how is it set apart from other parts of the plan?
So again, very complicated. Part A, most people are entitled to if they've paid their Medicare taxes. That's their hospital insurance. Part B is physician services, which they usually opt into when they become eligible or age in. Part C is actually the combination of Part A and Part B, and that's Medicare Advantage. And then Part D is the prescription drug piece that was introduced in 2006 that individuals can add as a standalone prescription drug plan or a part of a Medicare Advantage prescription drug plan. A lot of people do get confused that Part D is part of the federal government. It is not. It's funded, like you said, by the federal government, but you have to get Part D or prescription drug coverage through a private insurance carrier.
And you do that through your plan, right?
Yeah, so we actually have a couple different plans. We have what's called Medicare Advantage only, which doesn't include prescription drug coverage. We have a number of individuals that get their drugs from the VA much cheaper than I can offer them. And then we have Medicare Advantage prescription drug plans that include Part C and Part D in one plan.
Medicare, pardon me, I need my Medicare medicine this morning. Medicare versus Medicaid, the difference.
So again, Medicare is through the federal government, through the Centers for Medicare and Medicaid Services. Medicaid is a lot of people get confused. Medicaid is actually funded by the federal government but administered or run by the state of Nevada. Medicaid is for the indigent. They offer additional health care coverage for those that can't afford their health insurance or a private carrier. And so what we call those individuals are full dual eligible. You have some that partially qualify, which they may get a subsidy for their Part B premium, and those that fully qualify for Medicaid benefits, where they get all their, if you're on original Medicare, you have deductibles and coinsurance, where Medicaid would pick those up. There are also other individuals that don't qualify for Medicare, but just have Medicaid, the state children's insurance program, SHIP, where children can get Medicaid services, let alone those that have Medicare.
Does it make sense for a private organization like yours to take over Medicaid, or will that never happen?
No, there's some privately run through the state Medicaid They have a couple HMO options through a number of different other carriers. I believe right now Humana and Health Plan of Nevada have a contract with the federal government to help offer a Medicaid, a privately insured Medicaid option to those individuals in the state of Nevada that do have Medicaid.
What are some of the advantages as we approach the end of the year? We start seeing a lot of advertising, hearing about different plans. What are some of the advantages of maybe taking a look at a new plan? Why should people, seniors, do that?
Again, a lot of individuals will get a lot of different mail. We were actually allowed to begin marketing our products October 1st, and that's when the deluge of postcards and mailers in the newspaper, advertisements started regarding our benefits. That election period didn't start again until October 15th, so they even got more mail after October 15th. I think it's an opportunity for them to shop around. Medicare actually sends them right before October a Medicare New Handbook that actually tells them exactly what they get covered for both Part A, Part B, what supplements are, what Medicare Advantage plans are, and then in the back it actually gives you a list of all the standalone prescription drug plans and Medicare Advantage plans in Nevada. So it gives them an opportunity to look, shop around, make sure that they're on the plan that's best for them, either based on their utilization or usually based on their costs.
Matt, we keep hearing a lot about buying drugs in Canada and how much cheaper they are. Are they cheaper, and why is that?
As I have a contract with the federal government to administer a Medicare Advantage plan, it sort of precludes me from saying that you can get drugs cheaper in Canada. With Part D, you have certain regulations that we have to abide by. Medicare does not cover or reimburse an individual Medicare beneficiary that gets drugs in Canada and brings those back. We're not allowed to cover those. However, I do have a number of members that go to Mexico or Canada and get their drugs and don't opt into the Part D program, which is entirely voluntary. They don't have to opt into Part D and they can get their drugs elsewhere. They might be able to get them for cheaper. However, we have had some studies done by Medicare and the federal government that actually show that those drugs that they're getting in Canada or Mexico may not be the medications that they thought they were buying. But there are some individuals that, that works best for them. They don't have to opt into Part D and they have an alternative.
Do seniors need a supplemental plan in addition to the regular Medicare? You hear about the supplemental backup kind of plans. Is that, how do you get that, and do you need it?
Some people do. There are a number of individuals actually in Washoe County. I'll use Washoe County as an advantage or as an example. About 25% of the Medicare beneficiaries, which are about 60,000 in Washoe County, 25% of them are in a Medicare Advantage or standalone prescription drug plan. The other 25 to 30% are in a Medicare supplement, and there's actually almost 40% that are in just standalone or traditional fee-for-service Medicare that don't need a supplement. Again, that's really based on their utilization and cost. We see a lot of those beneficiaries that are coming in because I have Part A and Part B and I don't utilize a lot of services, I don't take any generic drugs, I'll just continue on original Medicare. There are others that are seeking not only help for their deductibles and coinsurance on a Medicare that would need a supplement or a Medicare Advantage plan, but also the Part D benefit, prescription drug coverage, and possibly supplemental benefits that a supplemental plan or a Medicare Advantage plan like Senior Care Plus can offer, like dental, hearing, vision, acupuncture, that Medicare doesn't cover. And that's where a lot of people are seeking the Medicare supplements or Medigap plans or Medicare Advantage plans like Senior Care Plus.
Do you list a group of doctors that accept your plan, or I believe I've read in some of your copy on KUNR that you can select your own doctor. Is that true? Your own specialist?
And that's one of the big differences between supplements and Medicare Advantage plans. The Medicare supplements, you're essentially on original Medicare and you have a supplement or a secondary plan that helps with all your deductible and coinsurances. You can see anybody that accepts Medicare or accepts Medicare assignment, a physician. On a Medicare Advantage plan like Senior Care Plus, we have HMOs and PPOs, health maintenance organizations and preferred provider organizations. Our health maintenance organization, HMOs, have a provider network where we would like you to stay in network and see our contracted physicians because we've gotten a deal from them and hopefully we can pass those savings on to our members. We also have PPO options where they can go in or out of network. But on our HMO plans, all of our members are quite satisfied. We have the largest provider network in Northern Nevada. Plus with Medicare Advantage plans, you're required to offer ER coverage anywhere in the United States. We offer actually emergency coverage anywhere in the world, and then urgent care anywhere in the United States. So somebody is covered if they were to leave the Truckee Meadows area on a Medicare Advantage plan.
In Northern Nevada accept Medicare payments?
Yes. However, I'm sure you've heard some in the news. There's been talk both in Congress at the federal
My
government
next
level.
question, yeah,
Yep.
the entitlement program.
With the SGR that was put in place a couple years ago and has been sort of not repealed, but sort of remanded every single year, where the physicians, the Medicare physicians, were supposed to receive a reduction in their pay. Last year it was supposed to be 22%. This year it was supposed to be another 28%. And then every year Congress goes in and says, you know what, let's just put that off another year. That will come to head probably this year or next year, where Congress is going to have to do something, because part of that is helping pay for the Healthcare Reform Act. We do get a number of questions from our physicians saying that if we're going to receive a reduction in pay from Medicare, we will opt out of Medicare. Now for us, Senior Care Plus, we're actually required to only contract with physicians that accept Medicare assignment. So that would actually hurt our provider network. We're hoping that doesn't happen. Because we directly contract with physicians, we can sort of intercede and maybe pay them a little bit more than what Medicare is paying. But it is going to significantly impact our provider network, as well as Medicare beneficiaries in general that are seeing providers today. If that were to be enacted and those reductions were to happen, there will be a number of physicians that will probably opt out of Medicare.
And benefits eventually probably will be passed along to the recipients of Medicare. The benefits aren't going to be as good, right?
Correct. Not only will they not be able to see their physicians, or physicians that are a little bit better than maybe others because they will accept that reimbursement, benefits will actually, like you said, possibly decrease because of the number of physicians that are available.
Are you associated with Renown? Is that your main hospital?
Yeah, again, Renown is actually our parent organization. So Renown has an insurance division called Hometown Health. Hometown Health has a contract with the federal government. We call that Senior Care Plus.
My question is, obviously a lot of physicians on staff under contract at the hospital at Renown. So people would be able to see those physicians, and they would stay in the Medicare plan because it's so closely aligned with Renown.
Again, that's one of our advantages, being a part of Renown Health. Hopefully those physicians understand the importance of that community benefit and opting in and accepting Medicare beneficiaries in our community and not opting out as part of that. And Senior Care Plus, having the largest population of those Medicare beneficiaries in Washoe County, can hopefully help influence that decision by the providers.
Matt, Woody Allen had a great line once. Woody Allen said, "There's nothing worse than death." And you know, he's preoccupied with death. And then he went on to say, unless it's spending a night with your insurance agent. Well, maybe I can say that spending a night with somebody explaining this plan. Is there an easy way to do this, to get online, to make a phone call, to get a booklet, to find out more about what we've talked about today?
Yeah, again, we're hoping everybody goes to 1-800-MEDICARE. They can talk directly with Medicare or on their website, www.medicare.gov. You also have an objective resource here in Washoe County as part of the state Health Insurance Assistance Program, SHIP, that's actually administered by the Access to Healthcare Networks. You can go and get objective advice from their volunteers, and then you can always give us a call, 888-775-7003, or go to our website, seniorcareplus.com.
Matt, an excellent explanation of a very kind of hard to explain problem. Good luck to you, good luck to Hometown Health and to Senior Care Plus, and we hope to be able to talk to you again as this thing progresses. Thank you very much. Thank you, and we'll see you next time right here for Bob Carroll and Friends.